So today I am going to speak on using your physical generals, physical particulars in your day-to-day cases. Since most of us know each other well, so you know my approach also. The use of repertory for me started long time back. Earlier I used to prescribe on concept of a drug. Like suppose a patient comes to you with asthma, and I used to prescribe on whatever I know about that picture of asthma. Suppose antim-tart, we have a picture. Arsenic, we have a picture. And if you see few symptoms matching and then you corroborate with the mental state, it used to work patchily. Until we had some recurrences and some bad results. That time I developed this approach of using physical particulars in a very peculiar way, and then I got addicted to it, to tell you the truth. Why I tell you I got addicted to it? Because we could get results instantly. And the type of my constitution, the way I am, I want to always see results immediately. So this is how my journey began. So when we are taking a case, I am telling you the way I look at these cases when they come to in my clinic. Generally, it is patients come to me with problem in the problem. So whether it's asthma, they'll be gasping. So it's pain, so they'll be in pain, and hardly we have a time to evaluate. So most of the time, I am just focusing on the patient, looking at him, trying to get something so very peculiar, which is unchangeable and constant for time, place and person. Okay, purely objective. At least 2 or 3 things have to be purely objective. So this is one thing that I strongly believe, and this is on which my whole case taking goes. I actually call this as one crazy thing which a patient does during the problem. And in the first 10 minutes, I am actually watching for that crazy thing which the patient is either telling it to me, either showing it, or either I am seeing it to be for sure the anchor which will not be changeable, and it will not be something of my perception. Are you there with me? You understand? Nothing that I will see will be my perception. It will be something which will be unique and which will not have any competition. Okay, this is the way I work first. I feel that to see this is a skill. I did not know that I had it. Neither I feel that I have it completely. But when I see my friends doing it, I feel, why didn't you see this? Why didn't you see this? This is peculiar. Why didn't you hear this? Okay. And like what Sir has written in his book, to see the peripheral vision, to see things behind, to see what is happening, what came first. Okay. Something which is unsaid, but which is obviously there in front of you. That part to be seen in a patient will qualify you head and shoulders above the rest of the homeopath, I feel. Because what speaks about us is your practice. I don't think anything else, any results. If you are giving magical results, patient will be crazy for you. Now, since I am going to speak on the physical generals, I will be focusing on in that part of case taking. The most common thing is the modality. When a patient comes, we all ask modalities, isn't it? So generally do not rely on the common modalities. The common modalities come and you give only a common drugs. And your totality also will come to a common drug. Maybe after finding a peculiar modality also you will come to a common drug. But the peculiar modality will relieve the patient faster rather than the common modality. Are you there with me? So whenever you are looking for a modality, please don't look at the commonest ones, look for the rare ones. Now looking for the rare ones, you will say, then I have to know all the modalities. And there are so many modalities that we don't know. isn't it? There is a way where you can ask open questions and ask him to demonstrate what he does when he has a problem. And most of the patients will give you one weird way. I told you one crazy thing. They will tell you one weird way. Okay? And that weird way is what you have to find in the repertory. And repertory has it, even if you don't know. Okay? And it's a chance that you may not know. Another thing is the keynote. So many a times my whole cases which I'm going to do are based on all these things. So I'm just telling you so that you can focus right now on those things which I am going to show you afterwards. It can be a very peculiar symptom, what he is speaking about, a concomitant, a locality, a direction of pain, an alternating symptom, modality. Now this can be a keynote, but I will be always watching for something which is very, 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 very peculiar. It can be anything.